When do you want to get started? Like 35? Is that good?
Yeah, that's good.
Good.
All right, hello everyone on Zoom and YouTube. I hope you're well. We're gonna start at 5:35. So
when do you want to get started? Like 35? Am I lagging? I hope not.
yeah, you're good. My YouTube wasn't muted.
That's good.
Also, if any of you here know people that aren't able to get in, chances are the room's already full. So if you could ask them to go to YouTube Live, that would be great.
I guess I'll ask a question real quick for you guys. If you want to leave it in the chat, do you guys know what common variable immune deficiency is, or any other type of primary immunodeficiency? I'm just curious because I know it's a pretty rare disorder and it's not often discussed, especially among the medical community. Sounds good. Well, I'm excited to teach you guys about it.
I forgot to post on Instagram.
I'm gonna mute my phone, make sure no one calls me in between. I guess we can get started now if that's good.
Yeah. Okay, just like give me 30 seconds real quick. I'm sorry.
Okay. No, you're fine.
All right, we can begin. Hello everyone. I hope you're well on Zoom and YouTube Live. Today, Victoria is going to be presenting on common variable immune deficiency. So, actually, I'll share my screen for you. So, Victoria, whenever you're ready, you can begin.
Okay, sounds good. So today I'll be talking about a major or a common type of primary immunodeficiency. And if you guys have any questions afterwards, after I've answered the question in the chat, or if you have any questions like after the session's over, feel free to email me. My email is right there. You can go to the next slide. So I'll be going over a brief introduction as to what CVID actually is. Well, CVID is a type of primary immune deficiency, which basically means that it's a genetic immune deficiency. Something happened with your chromosomes, something happened with any sort of gene, which leads to a protein malfunction. CVID is called hypogammaglobulinemia, hypo meaning low, gamma meaning closely related chemical substances, and actually the Greek letter gamma, it looks like a Y, which is conducive to the antibody shape. Antibodies have a Y shape, so we know that it's a disorder revolving the immune system, revolving antibody production. Globulin is blood serum protein, and anemia is basically conducive to a condition revolving blood. With hypogammaglobulinemia, or CVID, patients have an impaired specific antibody response to vaccination. There are 5 different subclasses of immunoglobulins, which are the antibodies, but it can be different in every person with CVID. It's a big spectrum disorder. People with CVID are susceptible to infection from foreign invaders, so they're able to get bacterial infections and viruses very easily. And the infections are usually located in the lungs, the sinuses, the ears, and the GI tract, although they can spread to other areas and organs of the body as well. So it's a relatively rare disorder. 1 in 30,000 people are diagnosed with CVID, making it one of the most common primary immune deficiency disorders. But it's still relatively diagnosed at a later age. So many people who struggle with this disorder may go for years and years at a time without receiving a diagnosis. So they may have a multitude of health issues before their diagnosis. So I'll go into the signs and symptoms of this disorder. So the big one is recurrent and severe bacterial infections involving the upper respiratory tract and the GI tract as well. There can also be an enlarged spleen, enlarged lymph nodes, fatigue, anemia, infection or inflammation of the GI tract, which can oftentimes be chronic. With these patients, you see abdominal pain, a lot of weight loss. Some patients actually start wasting away, so their muscles begin to atrophy and they're not as upbeat, or they don't have as much energy as they used to. They get a lot of bloating. They're not able to absorb their nutrients as well. They have diarrhea and other kind of bathroom-related disorders as well. And another one is chronic cough, which I'll actually talk about the implications of that later on in the presentation. So there are actually a lot of impacts on the body system. CVID is not just does not just impair the immune system. The blood cells, as you probably would have guessed, are most frequently affected by autoimmune attacks on CVID. The most commonly occurring autoimmune disorders are immune thrombocytopenic purpura, which is actually an abnormal bleeding disorder. It's caused by a decrease in platelets, which are your blood clotting factors. And there's another one related to the blood, which is autoimmune hemolytic anemia, which results in the premature destruction of red blood cells. Other autoimmune disorders such as rheumatoid arthritis, lupus, asthma, type 1 diabetes, they're pretty common in people with CVID because it leads to a sort of immune dysregulation. Immune dysregulation is when the immune system can't recognize itself from foreign invaders. So I think of it as if the immune system is basically defective. You may have good numbers, but you may not have a good function of your immune cells. So the function of your immune system is completely thrown off, and sometimes your immune system, whatever you do have of it, may be more preoccupied attacking your body than real threats. So that's also why you could have a weakened immune system. It's not focused on destroying pathogens, but it's more focused on destroying your body. Then we also have a bronchiectasis, which is permanent damage of the bronchial tree from scarring. Usually patients with this have chronic pneumonia or bronchitis, and the airways kind of narrow. So they have a lot of lung difficulties and trouble breathing. And then another one we see granulomas, basically when the immune system cells called macrophages, they accumulate in other organs. They're not functioning, but they just kind of sit there and turn into little tissue nodules, and that can actually impact one's ability to breathe, their lung function. There's also some liver involvement that can lead to liver enzyme elevation, which can lead to cirrhosis, scarring of the liver, which also decreases its function. And people with CVID also have an increased likelihood of developing cancers related to the blood, the immune system, and gastric cancer. So a big one with CVID patients is non-Hodgkin's lymphoma. The tumors basically develop from your white blood cells. There's too many of them, or there's too little, and they just attack and they mutate because of these defects in the T cells. So I'll go into a bit of the pathophysiology of CVID, the genetic basis of it. So first, you have to understand what an antibody is. An antibody is a Y-shaped protein that basically finds the enemy, finds whatever foreign invader is attacking your body, and marks it for destruction from other immune cells. So it's just kind of like it tags it and it leaves the immune system to actually engulf it or attack it in other ways. It's a major part of the adaptive immune system, which is the part of the immune system that learns to recognize and eliminate these invaders. So here are the 5 specific types of immunoglobulins. IgG is the most abundant. It's found in blood and body fluids, and it can cross the placenta to protect the fetus. So this is a major antibody that's important in the development of the immune system of a baby. IgM is made by mature B cells. It's the first antibody the body makes to fight infection. IgA is found in the linings of the respiratory and digestive tract, the tears, saliva, and other bodily secretions. So breast milk, babies, they initially, when they're first born, they have low levels of IgA, but through breast milk, they're able to get the mother's antibodies. IgD is the least understood antibody, but we know it's present on most of the surfaces of B cells, rarely released into circulation, so sometimes they're not that detectable in blood tests. IgE is also a major antibody involved in allergic response. So if you have an allergy to something, when those antigens bind to these molecules, histamines, and all those chemicals related to that allergic response are released. And these antibodies also protect against parasitic infection. So basically what happens with CVID is you can see here, these are immature B cells. So the pro-B cell, pre-B cell, and the immature B cell, they develop in stages. What happens with CVID is they get to be mature, but they never differentiate into the other subclasses like a plasma cell or a memory B cell, which are needed to produce other types of antibodies that are necessary for an effective immune system of response. So people with CVID typically have low Ig levels because those are made by the plasma cells and as well as the memory B cells. So there are multiple gene abnormalities that can cause this, or sometimes these mature B cells, they'll just die. They'll just go through a process called apoptosis, which is programmed cell death. And no one really knows why, it's just a gene abnormality. Oh, and I forgot to mention as well that B cells mature initially in the bone marrow. They produce these antibodies and they go through receptor molecules. So they're not involved in actually attacking pathogens. They just produce the antibodies which target or mark the invaders so other immune system cells can attack. So I'm going to go into a bit about diagnosis techniques. There are many out there, but they're commonly misunderstood. So typically how doctors test for CVID or any type of primary immune deficiency is they do a blood test and they do an immune system workup. So they test for these low blood serums, these low immunoglobulin levels. And here you can see the severely reduced is anywhere from 100 milligrams in adults to just below adult normal range, which is 500. So they can vary in severity of disease. A laboratory testing may also reveal normal B cells that are circulating in the body, but they can see through microscopes and other techniques if they actually mature and further differentiate into immunoglobulin creating B cells. Then there's also specialized imaging tests. So if someone is concerned that they have bronchiectasis or they're developing granulomas in the lungs, they will test for that. And if they do find granuloma, it can show signs of CVID. And they also do enteroscopy, which is an intestine biopsy. What I said before, IgA is the antibody that's found in the intestines, in the lining of the intestines. So if someone does a colonoscopy and they get low levels, the doctor gets low levels of IgA, that may tell them that there's some underlying immune problem here. Of course, if the patient hasn't been on like other immune suppressing drugs or environmental factors that would decrease the function of their immune system. And then there are also specialized lab tests to determine what specific immune deficiency they have. There are over 400 different types as to date. There are always new ones being discovered. And so it's a pretty new field, that a new medical field, and it's commonly misunderstood. So many people, what they do is they'll go through genetic testing if they don't have specific answers, or their immune deficiency is just unlike any diagnosis out there, to try and target which gene may be causing these abnormalities. So the average age of diagnosis is anywhere from 20 to 40 years. So people can live a long time with these diseases, but they will oftentimes have very limiting health issues. Their quality of life may be really bad until they are diagnosed, until they are put on therapy. And many doctors don't think of this diagnosis even because it is so rare. They will always prescribe antibiotics if someone's sick, or they'll just say they'll have the flu, or the kid is just sickly. I know I was told that a lot when I was younger, that I was just a sickly child. But if you advocate for yourself and if you know something's wrong, you're always getting sick, you're always getting these weird opportunistic infections, or they're always reoccurrent. They don't go away with antibiotics or steroids. It may be something to look into, tell your doctor about. So then I'm going to go into the main treatment of CVID. So CVID's main therapy is called immunoglobulin replacement therapy. This can be administered two ways, either subcutaneously, which is injected into fatty tissue under the skin. This can be weekly or biweekly, and it's the immunoglobulin is released over a period of a week. And what immunoglobulin, how they get it, is people will donate their plasma, and in plasma there's a small percentage that is the concentrated antibody. This obviously goes through a purifying process, and usually in one dose of subcutaneous infusion, there can be between 1,000 to 10,000 donors' antibodies. Intravenous is an IV infusion directly through the veins. This is monthly, and it's a direct release into the body. So you'll see once you get IVIG, that's what it's called, in intravenous immunoglobulin replacement therapy, you'll notice that you will peak, and then through those next couple of weeks, so like week 3 and 4, you'll get to a very low point. So I take subcutaneous immunoglobulin replacement therapy because it just works better for me, and I'm constantly at the same level of antibodies. So there's really no risk. There's no risk for me, and it's just more convenient. People with subcutaneous can do it at home, actually, through a pump. They can self-infuse. With intravenous, you have to go into the hospital. You have to have it done by nurses or doctors. Patients with CVID, however, could be less responsive depending on different antibodies they are lacking, or depending on other health factors. So it's recommended to have a regular checkup with your doctor to see your antibody levels and to see how your lungs are functioning. Intravenous can have more side effects. So people with intravenous, who take intravenous therapy, can have other complications like viral meningitis. That's a big one, or they can go into anaphylaxis. Although it's very rare, it's still a possibility. Most common, it's headaches, fever, stuff like that, nausea. Subcutaneous is pretty much headaches. You may get a little bit nauseous, definitely swelling and redness around the injection site, but it has less symptoms than if you were to get IG intravenously. So then I'll go into a bit about the burden on society, how exactly CVID affects society as a whole. So there are quite a few comorbidities associated with CVID. As I talked before, it doesn't only affect the immune system, it affects many other organs and other organ systems. And people with CVID who tend to develop these, like cancers, digestive disorders, severe autoimmune diseases, they are more likely to get a serious infection, or they are most likely to die because of their comorbidities. There's not that much of a burden on society, given it's a relatively rare disorder. Only 130,000 people do get this disease, but it does have a severe impact on the individual. It may affect their quality of life, depending on how long they waited to get a diagnosis or how long they weren't able to get a diagnosis. The disease may have progressed or manifested in other forms. I'll go into a quick case study. So I found this case. It was a 42-year-old white female. She comes into the emergency room with a fever and cough, and she also has chest pain. She was actually discharged a week prior from the ICU for multi-organ failure. Her past medical history includes COPD, recurrent pneumonias, recurrent sinus infections. And when they tested her, they found that she had leukocytosis, which is a very high white blood cell count. She also had chest x-rays done, which showed that there were substances that were denser than air. So some tissue or something was sitting in her lungs at the bases of both of them. She had a temperature of 99.8. People with any type of primary immune deficiency can actually have lower body temperatures. So a typical person has 98.6 around. A person with PI can have a 97 normal body temperature. So if they start feeling like they have a fever, but their temperature is like relatively normal for a normal person, they may just be dismissed. They'll say, the doctors and healthcare providers may say that you don't have a fever, when in reality, your body is warning you that there's something wrong because you're not used to having that high of a temperature. She was also extremely tachycardic. She had a very high heart rate, and she was typenic. She had a rapid breathing. Her blood pressure was low, and her oxygen saturation was 88%. Normal is typically between 95 to 100. I guess like the low end is 92. They'll say that's still okay, but 88%, there's still a warning sign. And she was even given nasal oxygen, she had an 88% oxygen saturation. So they knew that she wasn't getting the oxygen she needed. And then when they did the immunoglobulin workup, they found that all of her levels, IgA, IgM, IgG, were very, very low. So they put her on immunoglobulin replacement therapy shortly after. So then I'll go into a bit about my story. I had been sick basically my whole life as a baby. I wasn't able to digest or absorb food, especially not breast milk, and when I started eating solid foods, I would throw everything back up. My grandma would actually be in the kitchen and she would be making me multiple different types of food a day just so I could stomach something. When I was little too, I had back-to-back aggressive like upper respiratory infections. I always had an ear infection like every 2 weeks. And I was later diagnosed with asthma at around 5 years old. So they thought that it was because of my coughing, I was throwing up all this so often. I needed bronchodilators and steroids to open up my airways. And then I was like, okay. In middle school, I got really, really sick. I had 2 different types of flu. I had 2 different strains at the same time. And then no one really knew what was wrong with me. They still labeled me as just sickly. And then when I was 14 years old, I was so sick. I went down to 90 pounds and I could barely walk up the stairs because I was so weak. I was so fatigued. It was the worst fatigue. I would sleep for 16 hours a day. And it really interfered with my quality of life. This was after a really, really bad infection. So we did immune workup and it showed that I didn't respond to the pneumonia vaccine, or I had gotten pneumonia booster shots before, but I didn't make many of those antibodies to it. And I did not respond at all to the flu vaccine. And I had a low IgA level, which could have also explained why I was very intolerant to a lot of foods growing up and even throughout my childhood. I would be in the hospital a lot of times with GI issues and stomach viruses, and they would be very, very aggressive to me. I would be very dehydrated. So it was a very difficult 14 years, but when I got my diagnosis, I actually was put on subcutaneous immunoglobulin. So that helped me a lot. I've now been on it for nearly 3 years, and my quality of life has changed dramatically. I'm able to do the things that I loved now, and we actually found the Immune Deficiency Foundation, which has just been an amazing turnover for my life. I'm a teen leader, so I help other PI patients kind of go through the process of diagnosis and guide them through their journey. It doesn't even have to be about PI, but we just make connections and we connect with these kids. Because I know how isolating it is when you don't know anyone else who has your diagnosis. You need that sense of community, that sense of belonging. So on that right picture, I was actually at the IDF National Conference in 2019 with my siblings and my mom. So we had a really wonderful time there. And that was one of the first times I actually felt like I was not alone in this. I was not fighting this alone. Unfortunately, with my weakened immune system, I also have other autoimmune disorders like IBS, asthma. It gets pretty bad. My eczema, and then chronic fatigue disorder. But I've been getting much better, and I'm on other treatments for those ailments as well. And if anyone's interested, or you know anyone, you may be experiencing these symptoms, or you know anyone that's experiencing these symptoms, reach out to the IDF. They're a great resource, fundraising, and they provide a lot of patient resources in terms of everything, finding doctors, finding immunologists in your area that specialize in PI, doing testing, even outreach for genetic testing, and just finding your community. It's very important. They do also a lot of advocacy work. So if you're having a tough time advocating for your insurance company, or you're interested in being a bigger part, helping out the healthcare system, I definitely recommend looking into that. And so I'll talk about the lives of immunocompromised patients. Obviously, in the pandemic we're in, there are many bad things that go with having chronic illnesses during COVID. There's fear, there's uncertainty around health and vaccine schedules. There may be more severe symptoms and complications if you do get the COVID-19 virus. If you get the vaccine, you may not respond to it. You may not produce antibodies to it. And then, of course, there's extended periods of quarantine and isolation. So your mental health may not be the best during these times. I know I had a bit of a difficulty with this, but throughout the pandemic, I've just reminded myself that I have to do my part here too. It's not just me. And you just got to keep your head up high. So some things that the pandemic has gifted me, I was able to bring more awareness about immune deficiency disorders through like presentations like these, and telling people at my school about it, and advocating for policy changes in my school district that affected student health. And I had more opportunities to connect with PI patients all across the world through IDF, through forums and Zoom meetings. And actually, I did a podcast recently with IDF with two other amazing patients who I'm very glad to call good friends of mine. So if anyone's interested in listening to that, we basically talk about our life during the pandemic, how it's affected us, and the silver linings we found along the way with this disorder. And I think that's it. Those are all my sources. So if anyone has any questions, feel free to like on mic or put it in the chat, whatever you feel more comfortable with. Thank you, guys. That was really fun presenting today. I really enjoyed it. And again, if you have any questions, if I don't get to answer them in the chat today, just feel free to email me. And actually, if anyone wants like any of those links to IDF's website, or the link to the podcast, or my email or anything, I'll put it in the chat. So a white blood cell count, that's basically, it's one of the main immune system cells. White blood cells aren't, it's a very broad category. There are different types of white blood cells. B cells are only one specific category. People with this disorder may not have like a genetic abnormality that would cause them to have lower white blood cells than normal. They may just be lacking with their B cell production, or their differentiation into other immunoglobulin creating cells. So they may be deficient in one area, which would be their B cells, but then again, they may also have like normal levels of other IGs, other immunoglobulins, and they may have good levels of white blood cells. But typically what happens if you get any sort of infection, the white blood cells will increase in order to fend off the invaders. So usually these people, people with CVID may be deficient in one area, but they may not be deficient in the other area. You're welcome. Yeah, sure, you can email me. I'll give you the links if you want. I can leave the link to the presentation in the chat if anyone would like that, just so it's more easily accessible. Okay. Hold on. Sanjana, can you do that? Because I don't have the presentation. Like,
Sure,
I
can
can
do
talk.
that.
Sounds good.
So anyone on the internet was like, all right, here is a link to that, and let me know if you guys can view that.
I think I put it that everyone can view it. So
Yeah, put it to everyone that
I put it on the slides, the podcast. I put it on the slides. It's on the one about COVID-19. So you're welcome. It's the second episode in the teen series, and it was really fun to make. So if you guys want any insight, I think it's really informative, especially for people who have chronic illnesses or people who don't know that much about these immune deficiency disorders. I found that in COVID, we got a little bit more awareness in the beginning, but through these past couple of months, it's kind of tapered off. So I think keeping that momentum and just informing other people about it is really important. If you have any more questions, just let me know or unmute yourself. That also works too.
Yeah, after she's done finishing answering questions, I'll post the quiz and for everyone that's participating and watching to fill out to receive hours. And oh, Victoria, did you see my message to you?
Through Zoom or through
Yeah.
email?
Through Zoom. Okay, so there was just a question. The question was, how many hours do you get when you run your own workshop? So that for that, it depends on how much time you spend working on your presentation. So obviously it's going to be more than an hour per workshop. It's probably going to be somewhere close to depending on how much time you put into your slides and stuff is how much you get. And another question was, how do we collect all our hours? So for that, obviously, you guys will be responsible for like monitoring what programs you participate in and what how many hours you collect for each program. And then if you need verification or anything, you can email us at clubmed.volunteer@gmail.com.
Well, if no one has any questions, that's fine. I don't know. Sanjana, do you want to take over then? If no one has any other questions?
Yeah, that's fine.
Sounds good.
All right. Well, Victoria, thank you so much for presenting. This was such an amazing presentation. And everyone else, I'm going to post the quiz link in the chat of both Zoom and YouTube Live, and Victoria, whenever you want to leave, you can.
Sounds good. Thanks so much for having me.
Thank you for presenting.
I hope you guys enjoyed the presentation. But remember, if you have any other questions, feel free to email me. Okay, sounds good. Bye, everyone.